Is Zika still a global health threat? The Zika virus made global headlines during the 2015 to 2016 outbreaks due to its serious impact on pregnancy and the risk of microcephaly in newborns. Although it's been known as an endemic virus in tropical regions, the widespread outbreaks raised international concern. In this video, we'll dive deep into the Zika virus, exploring its characteristics, transmission, and the ongoing risks, especially for pregnant women. Subscribe to our channel for more in-depth health insights and share this video with others to spread awareness about this still present threat. Don't miss out on crucial information that could protect you and those you care about from the risks of Zika. The Zika virus belongs to the Flaviviridae family, which also includes other mosquito-borne viruses like dengue, West Nile, and yellow fever. It is primarily transmitted by mosquitoes of the Aedes genus, particularly the Aedes aegypti mosquito. These mosquitoes are more active during the day, which increases the likelihood of daytime exposure, particularly in urban and suburban areas where these mosquitoes thrive. Most Zika virus infections are mild, with symptoms that often resemble those of other mosquito-borne viruses. Common symptoms include fever, rash, joint pain, and conjunctivitis, red eyes. These symptoms usually last for a few days to a week, and the infection tends to resolve on its own without specific treatment. However, in some cases, complications can arise, especially in individuals with weakened immune systems. The primary concern with the Zika virus is its potential impact on pregnant women. When a pregnant woman is infected with Zika, the virus can pass through placenta to the developing fetus, leading to birth defects such as microcephaly, where a baby's head is abnormally small due to incomplete brain development. This association has led to significant public health efforts to prevent and control the virus, particularly in areas with high mosquito populations. Zika's mild nature in non-pregnant individuals often leads to underreporting or lack of awareness. However, the potential for serious birth defects makes it critical for pregnant women, or those planning to become pregnant, to avoid areas with active Zika transmission. Mosquito control and preventative measures, such as using insect repellent and avoiding mosquito bites, are the best ways to reduce the risk of infection. The most alarming consequence of Zika virus infection during pregnancy is its strong association with microcephaly in newborns. Microcephaly is a birth defect in which a baby's head is smaller than normal, typically due to abnormal brain development. This can result in developmental disabilities, intellectual impairment, and in severe cases, it can even lead to death. The risk of these severe birth defects is particularly high when the infection occurs during the first trimester of pregnancy, a critical period for brain development. In addition to microcephaly, Zika infection during pregnancy has also been linked to other serious neurological complications in infants. These include damage to the central nervous system, leading to motor and cognitive delays. Some infants may experience lifelong challenges, such as seizures, hearing loss, and vision problems. The link between Zika and such developmental issues has raised global concern, particularly in areas where the virus is endemic or where recent outbreaks have occurred. Another serious neurological condition associated with Zika infection during pregnancy is Guillain-Barré syndrome, a rare but severe disorder where the body's immune system attacks the nerves, leading to muscle weakness and paralysis. This condition can develop in adults and has been reported in some individuals after contracting Zika, particularly in areas where the virus is widespread. Guillain-Barré syndrome can lead to long-term disability and even death in extreme cases, further compounding the risks of Zika virus infections. The impact of Zika on pregnancy has led to increased vigilance and preventive measures in affected regions. Pregnant women or women planning to become pregnant are advised to avoid travel to areas with active Zika transmission. Public health guidelines recommend mosquito control, the use of insect repellent, and safe sex practices to reduce the risk of infection. Given the potential for severe birth defects, the Zika virus remains a critical concern for maternal and child health. The Zika virus is primarily transmitted through a bite of infected Aedes mosquitoes, particularly the Aedes aegypti species. These mosquitoes are most commonly found in tropical and subtropical regions, where they thrive in urban environments. The mosquitoes breed in small water sources, such as standing water in containers, tires, and other areas, making dense urban areas a significant risk factor for transmission. This has led to widespread outbreaks in regions like South America, Southeast Asia, and Africa, where mosquito populations are abundant. In addition to mosquito transmission, there is growing evidence that Zika can be spread through sexual contact. The virus can be transmitted from an infected person to their partner, even in the absence of symptoms. This has raised concerns about the role of sexual transmission in the spread of Zika, particularly in areas experiencing outbreaks. Public health guidelines recommend that individuals in affected areas use condoms or abstain from sex to prevent transmission, especially for pregnant women. While mosquito and sexual transmission are the primary routes, there are also reports suggesting that Zika can be passed from mother to fetus during pregnancy, leading to severe birth defects such as microcephaly. Although less common, blood transfusions and organ transplantation from an infected donor are also potential transmission pathways. This broad range of transmission methods makes Zika virus a significant public health concern, requiring comprehensive measures to prevent its spread. Preventing Zika virus infection primarily depends on effective mosquito control and person protective measures. Since the virus is transmitted by Aedes mosquitoes, the most important prevention strategy is to reduce mosquito exposure. This can be achieved through various methods, such as using insect repellent containing DEET or other recommended chemicals that are effective against mosquito bites. Reapplying repellent as needed is crucial, particularly in areas with high mosquito activity. Another key prevention measure is wearing long sleeves and pants to minimize exposed skin, especially in outdoor environments where mosquitoes are most active. For added protection, using mosquito nets and screens while sleeping is essential, particularly in areas with high mosquito populations. These physical barriers help prevent mosquito bites during the night, which is when the mosquitoes are most likely to be active. Eliminating standing water, where mosquitoes breed, is another critical measure. Mosquitoes lay their eggs in small bodies of water, such as in flower pots, gutters, and water containers. By draining or covering these sources of water, individuals can significantly reduce the local mosquito population. Regularly checking and clearing areas around homes and communities can help break the mosquito breeding cycle and prevent outbreaks. In regions where Zika outbreaks have occurred, pregnant women are strongly advised to avoid travel to areas where the virus is actively circulating. If travel is unavoidable, extra precautions should be taken, including wearing protective clothing, using repellent, and sleeping under nets. For those already infected, symptom management, including rest, hydration, and pain relievers, is typically recommended, as there is currently no specific antiviral treatment for Zika. Effective prevention, early detection, and symptom management remain the key strategies in controlling the spread of the virus. The 2015 to 2016 Zika virus outbreak significantly raised global awareness, particularly due to the microcephaly epidemic in Brazil and other countries in Latin America. The outbreak led to widespread concern, as Zika was linked to severe birth defects in newborns, especially when pregnant women were infected. In response, global health organizations like the World Health Organization, WHO, and Centers for Disease Control and Prevention, CDC, implemented comprehensive measures, including surveillance, public health campaigns, and large-scale mosquito control programs aimed at curbing the spread of the virus. While the immediate public health threat posed by Zika has decreased in many regions, it remains a concern in areas with active mosquito populations. These regions continue to face the risk of new outbreaks, especially during the warmer months, when mosquitoes are most active and the virus can spread more easily. Seasonal changes can exacerbate the situation, as higher temperatures and increased rainfall create ideal conditions for mosquito breeding. To prevent future outbreaks, it is crucial for governments and health organizations to maintain mosquito control efforts and monitor vulnerable regions. Ongoing public education about prevention measures, like using insect repellent and eliminating standing water, is essential to keeping the virus in check. The global concern remains, and continued vigilance will be necessary to prevent Zika from becoming a recurring threat to public health. In conclusion, the Zika virus continues to be a significant global health issue, especially for pregnant women and their unborn children. The potential for birth defects, particularly microcephaly, remains the primary concern. However, the virus can also cause other neurological complications, further emphasizing the importance of prevention. As Zika continues to affect regions with active mosquito populations, efforts to control its spread are vital for reducing the associated risks. Preventing Zika transmission requires a combination of mosquito control, public health campaigns, and personal protective measures such as using insect repellent and wearing protective clothing. With no vaccine or specific antiviral treatment available for Zika, it remains essential for individuals to take precautionary steps and for governments to maintain efforts to reduce mosquito populations. Public awareness, along with proper health protocols, is the key to preventing further outbreaks. If you live in or plan to visit areas where the Zika virus is still active, staying informed and taking preventative measures is critical. Eliminating mosquito breeding grounds, avoiding mosquito bites, and staying up to date on the latest health guidelines are the best ways to protect yourself and your loved ones. Don't forget to subscribe to our channel for more health updates and tips on staying safe from viruses like Zika. Share this video with your friends and family to help spread awareness. Also, be sure to check out our other videos on related health topics to stay informed and prepared.